Hey, Cousin Will, future Dr. William Paulson, and all your classmates. This is Chris Paulson. I am number one, as they call me, the oldest of the 12 Paulson cousins on the O'Paulson side, as we'll call it today on St. Patrick's Day. And I am also the one who has colorectal cancer, or as I believe, who had colorectal cancer due to the amazing care of some of the best doctors and surgeons and nurses and caretakers, and belief that I have within that you can fight and beat this disease, and that someday future doctors like yourselves will find a cure for cancers and all those other diseases that just seem to baffle the mind. Let me just give you a quick update where I'm at. June 24th was the day that changed my life. I was diagnosed with colorectal cancer in an emergency room of a hospital in Cedar Park, Texas, which is just north of Austin. I had some symptoms that were unusual to what was ulcerative colitis, which I was diagnosed with in 2000. If you know, ulcerative colitis is an inflammatory bowel disease, and for me, symptomatically, it was lots of bowel movements throughout the day. 15 to 20 were not unusual, but it slowed down, and I began to have a stomach that was very large. And so I went to the emergency room, and they found a tumor that was blocking the colorectal area. And the emergency room physician came in at 2 in the morning and told me something that changed my life. He said there is a 99% chance that the biopsy that we found will be cancerous. And I didn't know how to react to that. The doctor's bedside manner was great, but I just don't think as a doctor you're prepared for what a patient's response is going to be. I think the best thing that you can do is just sit there honestly and just be silent and allow the patient to take it in as it needs to be, and then be willing to listen and to answer questions the best that you can. And that's what he did, and I'm fortunate for that. I had to place a call to my wife, which I'll never forget. We'll zoom forward. About another 2 weeks, I had to have an emergency ileostomy, which is a stoma in my small intestine to relieve the blockage. We'll move forward another 2 months. I started my chemo and radiation therapy at MD Anderson in Houston, Texas, and underwent 28 treatments of that. And then we'll zoom forward to November of this past year, where I had a 10-hour surgery where my tumor was removed. It had metastasized to the prostate, so they had to remove the prostate as well. They also removed the whole colon, and they had to sew up my perianal region, which will not be in use anymore since I have a permanent ileostomy. Move forward a little bit further, and I am now in chemotherapy. I'm just showing you my short haircut, and everyone asks me, is that your hair? Because of chemo, no, it's not. I just keep it short. But just to wrap up and to keep it short, I gave you kind of where I'm at and just kind of my clinical situation. But what I think you need to understand as prospective doctors is that each patient is individualized. And even though the books teach you an overall perspective of treating a person with this type of disease, it really helps to get to know that person. For me, I like to understand and know more about the biology and the makeup and the chemistry of everything that I'm going through, just so that I know what's going on. And I like to be hands-on with everything that I'm dealing with. Others may not be ready for that, but just the best advice that I can give is just be prepared for each patient, knowing that each patient is going through a different walk, a different struggle, a different scenario. And when you walk in that room at 6:30 in the morning to do your daily checkup after a surgery in a hazily lit room like this video probably is going to come out to be. You don't know who you're going to be getting involved with. So just do your best to do as quick of an analysis of who that person is and try to guide them along the way that way. I encourage you, and I'm greatly encouraged myself to know that there's more individuals out there like my cousin Will, and like yourselves who are studying to beat this disease, that as patients and doctors that we can beat together. And you do that by knowing the patient, not just by what the records tell you, but what that patient tells you and who you think that patient truly is. And I wish you guys all the best. Professor, give them all A's. And you guys have a great day today. Thanks for letting me share.